Okay, so now we move into our next session when we've got a further couple of talks. And I'm just making sure we're starting with Diane. And Diane Finegood, Professor Diane Finegood is visiting us all the way from Canada. And she is an example of someone who I can almost describe you as transdisciplinary. I'm not sure quite what she is, but she started as an engineer. She's also a physiologist, and she has been working in the field of public health, and particularly on systems research. She's a member of the PRP Scientific Advisory Board and has been thinking a great deal about how we bring systems thinking into our research area, particularly drawing on the insights from other disciplines, which I think from whom we've got a lot to learn. So, Diane, over to you.
When Anne asked me what my background was, I said I'm a mutt. So, and as you can see, I actually have a variety of things that I do. And but anyways, I'm really, really pleased to be here because one of the things I have done in my past is be a funder. And the idea of coming to a group of eager applicants and telling them a bit more about systems thinking is actually kind of exciting for me. So I'm really pleased to be here to do that. So here's the outline of what I'm going to say. I'm going to move quickly because they only gave me the sort of 20, 25 minutes, and there's a lot of things I want to say. We've whittled it down to the bare bones. But just in any good TED Talk, you got to make your audience care, so I'm going to make you care about systems thinking, give you some definitions, talk about how systems thinking differs from traditional approaches, and then give you some system thinking in practice. So there's no shortage of wicked problems, and I realized when I first put this slide together I didn't have Brexit on it, so I thought, well, I better do that if I'm in a UK audience. But clearly many of the things that are relevant to NCD prevention are complex or wicked problems. I use the words complex and wicked interchangeably. Some academics might argue with that, but that's just the way I am, and so as I go through the talk, we'll do that. So what is a system? It's a set of things. People, cells, molecules, organizations, whatever you want, interconnected in such a way that they produce their own pattern of behavior over time. So just think about it this way. And I'm going to focus on complex systems, but I want to make the distinction between simple, complicated, and complex systems. This is really the back pocket example of how these things differ is cake, rocket, child. Baking a cake is simple, reproducible. Anybody in the room, you don't have to be a particular expert to do it, and it's going to come out roughly the same every time. Sending a rocket to the moon, well, maybe not quite so simple, but it is reproducible, it's predictable, you can figure out how to do it with a bit of trial and error. You need some experts to do it, but then you can kind of do it mostly reproducibly. Raising a child, highly unpredictable. Even if you've raised one, the second one's a whole different story. You need to know a lot about the context and the dynamics of that individual in order to do that well. And so you need to shift from the experts in rocket science or metallurgy or whatever it is to people who understand the contextual dynamics, the parents, the teachers, those sorts of things. So you can see that, and importantly, to be successful in raising a child, adaptation and continuous learning are the modes as opposed to thinking you are going to solve a problem, okay? So those are really big distinctions, and I can summarize them even further here by saying complicated problems are predictable, they're controllable, and they're designable. Whereas complex is unpredictable, self-organizing, and emergent. Now, I know I'm presenting this as black and white. We're kind of getting used to black and white in this world for some reason. And it is a spectrum. So, not all complicated problems are not complex. Maybe that's not quite the right way to say it. There is a spectrum. As things become more unpredictable, you are moving towards something that is complex. And within the context of a complex problem, there may be some complicated problems. But I put this up as a kind of a fundamental dichotomy because I want you to also shift the way you think about how you go about solving complex problems. It's, in my mind, very different from the way we solve complicated problems. And you guys are all trained and used to solving complicated problems. So what is systems thinking? There's no common definition of this. This is something we actually need to resolve. But here's how I use systems thinking in this talk, just so I can signpost it for you. It's a way to make sense of a complex system that gives attention to relationships, boundaries, and perspectives. And it's a mental framework that helps us become better at addressing complex problems. We've already talked about the fact that, and apologies to this, that we want you to work on solving problems. Well, actually, you can't solve a complex problem. You can make it better or worse, but it's not quite right to think you can actually solve it and you're done and dusted and you're going to get on with something else, okay? So this is I want you to shift your thinking a little bit, or if you can, come along with me a bit. Now, this is the evidence-based medicine pyramid, and we know that randomized trials and the methodology that we're used to is typically based on this. And this is pretty good for complicated problems like drug development and stuff like that. But if you think about it, when there's differences in communities and heterogeneity amongst populations, this washes that away. It gets rid of context, and it gets rid of the differences in populations. And it also privileges those methods that do that kind of, in a sense, washes away that context. So it's not as helpful for a complex problem. And in fact, it doesn't privilege things like expert opinion. And as I just said, it's the people on the ground raising that child or trying to resolve this complex issue, the experts on the ground, that are actually quite important. So just recognize that this is not quite as helpful in complexity. There may be some complicated problems within a complex problem, but in general, it's good for complicated. Now, why am I emphasizing all this? It's because the frameworks we use matter, right? It's the frameworks we use that drive the methods we develop, like randomized controlled trials, which then drive how we apply them. And what we really need to do is shift our frame of thinking from those predictable, controllable, designable to it's going to be unpredictable, it's emergent, and it's self-organizing. And if you shift that frame of thinking, that's going to shift the way you think about applying methods. And I'm not saying that all methods that we use today are out to lunch, but you need to shift your frame of thinking if you want to really become a systems thinker. And it's not something you can do overnight. I've been practicing for 15, 20 years, thinking about this, reading about it, and so it's important. Now, if I can do some comparisons here between what I label as reductionist or more traditional thinking and systems thinking, it's things like this. Traditionally, we want to isolate the parts because we figure if we can work out the causes of a problem, we can solve it. And then what we get when we put those back together are big, multi-component, complicated interventions because we've got all these isolated pieces that we're trying to put back together. Whereas in systems thinking, you want to focus on the interconnections, you want to explore the emergent nature of the whole, something that's hard to predict with methods that we have today, but where you want to understand the whole as it acts together. Our goal, as I said, solving a problem and establishing the truth, whereas in systems thinking, we want to develop a shared understanding. So those messy causal loop diagrams like the Foresight obesity map, it's not about being definitive about what causes obesity. It's about starting a conversation with a wide range of stakeholders about where each of you lies in that complexity, and I'll talk about that a little bit more. The nature of the problem, when it's simple or complicated, you can understand it objectively. There's linear cause and effect. But when it's complex, you have emergent causality, if you will. You have multiple interacting factors and no single solution or perspective that actually is going to solve the problem. Research questions, there's a really nice piece by Trish Greenhalgh, which this is in part based on, where she talks about how in a reductionist paradigm, the effect size of an intervention is, on its outcome. That's what you're trying to predict. And so, be careful about that when you're thinking about complexity. You want to ask, what does the intervention contribute? What happens to the system actors in response to the intervention? What are the unintended consequences of this intervention? That would be more systems thinking than reductionist thinking. Good research, methodological rigor is often looked for, fidelity, and here's a challenging one, because when when you're putting an intervention in a complex system, what does fidelity really mean? If you stick to the randomized controlled trial evidence base, then you won't be adapting it when the context changes. And so from a systems point of view, adaptation and continuous learning, generative learning, those are all important, as is still good theory. theory. And then the approach to data, we generally want to do our research and collect our data until we're done. But in a complex problem and in a complex system, you're always collecting data. And your data is about adaptation, not about proving. It's about improving, not about proving. And those methods and those variables may be different, so you need to be thinking about that. Now I'm going to break down what I say into sort of 3 domains fairly quickly, talk about how these things, how systems thinking applies in defining and describing a problem, how it goes to approaching, acting, and intervening. And I apologize for, I think the slide must have changed its height-width ratio. And then how do you evaluate and learn? And I'm going to go very quickly. I apologize for that. And but here we go. So when it comes to defining, I think this is actually where we spent the most time in public health, is working on defining and describing problems. Linear logic models, they tend to suggest that a problem is only complicated, simple or complicated. Social ecological models, which the public health people in the room will be familiar with. What I criticize about them is that they don't emphasize the interdependencies. I'm not saying they're terrible and they're bad, but you don't see the interdependencies, whereas the causal loop diagrams, that's actually all you can see is the interdependencies. I love this slide because I put all kinds of different titles on it because you can't read it. But you do get the impression that interdependencies are important, right? And it's hard to actually see what all those specific things are. Now, why I brought this here to you, I feel like I'm bringing coal to Newcastle, right? This is the Foresight obesity map from the UK, is I wanted to make 2 points about causal loop diagrams, which is one example of a way to define a problem. The first one is that they're good for understanding what the group of stakeholders in the room think. They're not definitive. They don't say this is what we absolutely know is all the interdependencies. It's a tool for having a conversation about what the different stakeholders believe are the issues. And that's an important conversation, as we just heard. This is a zoom out of the Foresight map that we did a bunch of years ago. The thickness of the lines is proportional to the number of underlying connections that were built into the map. And I bring it to you to make the point that it's clear to me there was nobody from the food industry involved in building the Foresight map. And that's because the people in the room felt that food production affected food consumption. And there's no return arrow. So nobody believed that what we eat determines what the food companies produce. And if you have somebody from a food company there, they're not going to agree with that statement. So it's just the point that, again, these are about developing a shared understanding in the tent that you pull together to address a particular problem. They're also an opportunity to have a conversation. So this is another version of the map that was given to me a number of years ago. And these are actually, the regions that are blocked off here came out of a cross-government conversation where multiple government departments came together to say, so where does our responsibility lie in this big, messy problem? And so they cordoned off these different regions where different departments had responsibility. So it enables a conversation about where you fit in the system. I know there are many people who have always worried about these diagrams as, policymakers will go, we can't solve the problem, let's move on and do something else. But they can also start a conversation about how we can work together, how each individual organization or individual doesn't have control over the whole thing, but when they come together, you actually can map out and do a lot. So I think that's the point here, that problem understanding and problem resolution come together. So in the defining mode, there's many different tools out there. I'm not going to stop and talk about each of these. We've just talked about causal loop diagrams, so there's a whole vast array of other methodologies that have been developed. I present them in the defining section, but they're relevant to also thinking about interventions and even about evaluation. But I even include now, because I actually sit in a Center for Dialogue, I've come to realize that even something as simple as dialogue is an important part of us helping to define the problem that we're talking about. So as you come together in your multi-trans interdisciplinary groups, dialogue is actually an important technique, and learning how to listen and an appreciative inquiry is important. So these are the three things that I've tried to tell you about problem definition. Use models and frameworks that reflect relevant aspects of complexity so that you have a better understanding. So, linear logic models may not be the right tool when you're working on a complex problem. Use methods and tools that support co-creation to enable a shared understanding. And that's what's important about those defining methods. It's about having that shared understanding and bringing people along together to understand that it's complex, but that there are places within complexity that each organizational structure can work on. And that problem definition, problem resolution are done together. Okay, let's talk about, I'm going to quickly talk about the assess, evaluate piece. You have guidance in the UK for evaluating complex or maybe just complicated interventions. So when you read the guidance, it talks about these dimensions of complexity. So as you move from a stance of complicated and you add more interactions or more behaviors or more organizations, it moves in the direction of complexity. But my comment here is that you're starting from a place of complicated and pushing yourself into complexity. And there's nothing wrong with that, but it doesn't necessarily change the frame with which you're really thinking about the problem. And I'm going to give you some examples to help you with that. These are some of the methods that are described in the guidance, and some of them are definitely starting from complicated and moving to complexity. Others, like co-design, really does recognize that if a problem's complex, you have to work together. So, but you can find that stuff yourself and use that kind of material. What I really want, and then just to summarize around assessment, I really think that a key shift in mindset is if you focus on adaptation rather than attribution and fidelity, that you really want to keep improving things. Whereas when we use traditional reductionist methods, we want to hang on to fidelity and we want to say, here's the rules and we need to apply them the same in every place. And I'm going to give you an illustration that maybe there's another way to go about that. We want to improve rather than prove effectiveness. And I know some of what I'm saying is probably going to be challenging to the UK PRP. I've already challenged the UK PRP scientific advisory with some of these comments, but they did invite me to talk, so I'm okay. Apologies to the leaders. Consider outcomes of interest to diverse stakeholders. That's a natural from recognizing that it's multidisciplinary. Emphasize participatory and co-production approaches. Creating shared measurement systems, measurements that are applied to multiple stakeholders is going to be more effective in maintaining that engagement. And value different kinds of evidence. I say scientific, practice, contextual. Again, contextual evidence, expert opinion about context can be quite important. Okay, now this is the hardest one to talk about in terms of implementation because much of the evidence base we have comes from those reductionist approaches. So finding evidence-based approaches for changing the way we intervene is challenging. And I'll just make the comment right now while I'm saying this, that as applicants to the UK PRP, I'm extremely sympathetic to the challenge that you have. Because here I'm pushing you to think and do systems thinking in the work you're doing because I fully believe that it will help. But you're applying to a traditionally reductionist thinking organization. So grantsmanship is going to be critical. And from the grants that I read from the first round, there are good grantsmen out there that will be able to speak to both people who think in a reductionist fashion and think in an integrative fashion. But it's not easy, and I'm going to admit that right here, and it's a challenge. So Snowden has the Canavan framework, and the reason I put this slide up, I've talked enough about simple, complicated, complex. We haven't talked about chaotic. We're not going to go there. But I put this slide up for one reason only, and that is, in public health, we talk about best practice all the time. But as he points out, you can only have a best practice when the problem is simple. You can have a good practice when it's complicated, but when it's complex and each problem is unique and each context and setting is unique, you have emergent practice. And I want public health people to stop using the language of best practice when they're talking about complex problems. It's just a personal vendetta that I have. Another thing about systems thinking is that we have to think in different levels in a system. So Donella Meadows, a systems thinker who did work in climate change, wrote a paper called Places to Intervene in a Complex System, laid out 12 different levels. It was a bit much for, I really apologize the way the slides have changed. But anyways, the point I want to make here is that we rarely think about deeply held beliefs. And yet deeply held beliefs, or the paradigm under which the system operates, are the most effective if you can change them, but they're the hardest things to change. And as you go down, the goals and setting goals and finding ways to do that is challenging, thinking about the structure as a whole. And where all the evidence lies is actually down at the structural elements. Those are the easiest things, and we already heard that comment about what's easy to change, we can do, but they're less effective. So just one little illustration of that, we did a little look at recommendations to address obesity, again, a number of years ago, in which we parsed them into which level the evidence-based recommendation was about. And as you can see, most of the evidence is down at the structural element level. And I'm hoping that there'll be some brave souls here who think about how we can change things at other levels in the system, and also look to measurements in other levels of the system, like deeply held beliefs, to understand the impact of what you're doing. Now, as I said, I've been doing this for 10, 15 years. I've collected from a variety of systems thinkers what I think are systems approaches. We don't have time to talk about all of these, but I'm going to illustrate a couple of these points to you. The challenge, of course, is that for the most part, you could almost put these as theories or hypotheses about how you need to act in systems thinking. We don't really know the evidence base very well for these approaches. And actually, that's another piece of work I'm trying to make happen, is to actually figure out what is the evidence base for these systems approaches. But here's a couple of examples. So one idea that Bar-Yam talks about is that in those big messy, think of those that big causal loop diagram, it's counterintuitive to think that the individuals matter. But he argues that individuals matter, and what you need to think about is how you match an individual's capacity to the complexity of their task. And intuitively, that makes perfect sense. If a person doesn't have the capacity to address the challenges that they have, then they're more likely to fail. And counter that with, if they have the capacity or you reduce complexity, then they're more likely to succeed. It's intuitively correct. Just like if we ask people to figure out what their problem is, like in multimorbidity or mental health, and they have to figure out which doctor to go see, they're routing through different systems. That's okay if the problem is simple, but as it gets more complex, you want them to go through a door that actually enables and supports them in figuring out how to sort through that complexity. And you also want the people on the other side of the door to be working together to support that individual. So that's about matching capacity and complexity, that concept. And here's an example in British Columbia, where I come from in Canada, where they did this. So this is an example in the mental health space where a psychiatrist started by creating what he called the Granville Street Youth Clinic. So it was meant initially for street youth. But he recognized that what you need to do is create a youth-friendly door for youth who are struggling in some fashion with a mental health challenge. Don't ask them to self-diagnose and go over here to get job support, or here to get housing, or here to get mental health support. Make a youth-friendly space for them to come through, and then support them in figuring it out. So behind the door of this place called the Foundry, they have job support, mental health support, primary care, all kinds of different supports that might be helpful, and they have a mechanism for helping individuals through those doors that they need. You can do research in this kind of a way. So one of the reasons I know this is I was involved when they were scaling up this single site to 8 sites around the province. So now, if you're a traditional reductionist, you want to know with fidelity that we're implementing this particular intervention in exactly the same way in each community. But what they did is said, well, let's have a common branding, youth-friendly, but after that, we're going to work with them with a few parameters and principles about how this is meant to play out, but also work with them to adapt it to the context in which they're living, to the services that are currently available in the environment that they're in. And so they started with backbone and site-specific stakeholder engagement in order to start to think about scale-up. They then did developmental evaluation to do real-time learning and improvement. And it's really after the 8 sites are up and running that you can go back and ask the question, so what has to be there and what might not be there, not need to be there from a kind of fidelity point of view, because now you can study what's happening in each of those spaces. So that might be one of the ways that you change your thinking about how you understand what works in a particular context. I'll give you 2 other quick examples because I'm probably out of time. Am I? Yeah, okay. So one of the things I think about generalizability when it comes to complexity is generalizability should not be thought of at the place of rules, but at the level of principles. Because if you set principles for action, then you create a well-formed principle enables people in context to adapt, to try to figure out how in my context I'm going to live by that principle instead of how am I going to live by this rule that doesn't fit in my context. Okay, so that's kind of a basic. And this is an example from homeless youth. And so 6 different nonprofits, some were drop-in centers, some shelters, came together, and outreach organizations. They started by identifying their shared values and the common principles rather than having a rules-based approach. And then they determined the effectiveness of these principles using a case study approach. So you can do research in this way, and I really believe that a principles approach is a better way of changing and helping people shift their deeply held beliefs about a particular problem by coming together and agreeing on those principles, not on the specific rules, okay? And the last really quick example, from the health system, are clinical networks as an intervention. Okay? Networks as an intervention. This is an example from Alberta in Canada. They created a whole bunch of networks. These networks are designed around a topic like addiction and mental health, where the different stakeholders come together, and the stakeholders are quite vast, from clinicians and patients and families to the health system, et cetera. But they come together around something they're passionate about, like addiction and mental health, and they have a large number of these networks now, and they've had a real impact in Alberta, really significant impact in terms of money saving in the healthcare system. So you can think of a network as an intervention. So, and I guess I'll have to skip the last one. Am I really that far over time? Okay, so one really quick other thing I want to make is when we talk about synthesizing the literature, we can also begin to synthesize the literature from a systems perspective. So Lucy Lakeham and her colleagues took characteristics of complexity, which you can see here, and they applied them to a bunch of interventions, whether they said they were systems approaches or not, to address type 2 diabetes. So they had how many of these systems characteristics did they include, and then how effective was the intervention. And they showed that the more systems components you included, the more effective intervention. This is one place where there is evidence to actually establish that. And I'll skip over the examples. I don't know, are we giving the slides out to people? I'm happy to share them so you can read that stuff later, and just remind you that what I've tried to tell you is complex is not the same as complicated. So if you remember one thing from what I've said, that's the most important. Systems thinking is needed for complex problems. Systems thinking can be applied to defining interventions, assessing them, intervening, and we need more empirical evidence. So hopefully some of you will be brave enough to try to do that. Thank you. Sorry.